Tobacco addiction is one of the most severe addictions there is. Nicotine is actually a neurotransmitter. When you go to medical school, they teach you nervous system and nervous system physiology in the context of different kinds of receptors, one of which is nicotinic receptors. Our society, including physicians, as well as smokers or chewers or users, have not understood this. It's really important that we understand what is going on if we're going to help you quit the habit. Our approach to treating this is actually very different than what is out there. Yes, we can use the medications, and the medications have their role and they can be very helpful. Our approach is based on my experience in residency and beyond. My residency director actually started the research with some of the medications that are now used for treating tobacco addiction. I had a lot of experience through residency with a very large VA health system. 100 people at a time coming to the class. We had a special clinic just for tobacco addiction. We used the medications. We walked people through this. I then spent time at a large Kaiser center where my project in residency was to take the people that had been through the regular program multiple times and were still smoking, follow up with them, figure out what was going on, and then design a program just for them, the worst of the worst. I learned a lot in talking to a lot of smokers. What became apparent to me as I had the opportunity to ask them all kinds of questions is I started seeing the patterns. I started seeing what was going on in their lives and the role that smoking or nicotine was playing in their day-to-day lives. I found that there were about 12 specific things that smoking was doing for them. And I mean positive things. This sounds strange coming from a doctor, but it's actually true. If it wasn't doing something for us, something positive, we wouldn't smoke, right? It's kind of obvious, but we don't acknowledge that. We need to acknowledge that. People smoke for reasons, positive reasons. The number one thing I found was that it helps people deal with stress. It helps them calm down, cope with life. And when that goes out of the picture, it's intolerable, not only because of the chemistry of the withdrawal, but because they often don't have any other way of dealing with the stresses of life. So I found there's about 12 common things that people use smoking for. And that the thing that is most successful and should be the number one treatment is to understand that and give people things that serve those functions other than a cigarette. And once they have those functions, they really don't need the cigarettes anymore. Then it's just a matter of getting through the chemistry of withdrawal, which we can use the medications for. But as long as we're in this context or this frame of reference where we think that it's just the chemistry, we're not going to be successful. And the reality is the really good stop smoking programs, they don't advertise this, the really good stop smoking programs have a success rate of maybe 20%. And I can tell you from experience, working with this on a much more intensive level, which the science says we need to do and is not often done, and taking this very different approach where we actually deal with what's going on and put people in a position to be happy and successful long term, our success rate is 80+%. It's very good. So we look forward to helping you kick some butt.